Minus 7?
Mm-hmm.
$96.
All right. Can you say 2 quarters and a dime? What do you get? 2 quarters and a dime.
2 quarters and a dime.
Calms everyone down, gets everyone low. You can actually break off the chunk and hide and get away with it. It really doesn't disturb the bees all that
40.
much. That's so much it is.
Try again. 2 quarters and a dime.
We'll be back.
2 quarters and a dime.
You got it, honey.
2 quarters and a dime.
You got it.
Yeah. 40.
Fair enough. And then, could you tell me those 3 objects I told you to remember? What were they?
Bat, window, bed.
Excellent. Okay, very good. All right. And then, okay, I'm going to just talk to you a little bit about what the next steps are, okay? All right. So, first off, there's a couple of therapies I want to work with him while he's here, okay?
Okay.
Physical therapy to work on your strength, working on that, especially they're going to try to get you standing up, okay? I want occupational therapy to come and see you as well, okay? I haven't seen them yet in the note chart or anything, but I want them to see you and work on things like putting your clothes on, things that you do on a daily basis to start to see what your level is at right now, okay? Last thing, I do want speech therapy to come and work with you on not only the swallow aspect, but also cognition. So after we get a stroke, right, because you had a large kind of what we call MCA stroke, so in the stroke, it does affect your thinking, your memory, things like that. And so the best way to work on that, right, is going to be working on exercises for that. And so speech therapy, they're called speech therapy, but they actually work on the cognitive aspect of things. Make sense?
Yes.
Okay, very good. All right, last thing, I'm going to take a look at your vision here, okay? All right. Do you feel like a part of you is blocked out? Like you can't see part of your vision? Okay. Which side? Both. Can you look at my nose here, okay? All right. Just stare at my nose, okay? How many fingers am I holding up?
It's definitely clear.
2.
Keep looking at my nose here, okay?
Climb that tree.
On my nose, right here.
Back
Okay.
down.
How many fingers am I holding up? Okay. How many fingers am I holding up?
3.
No, don't look, don't look. Okay, look at my nose again. Look straight at my nose, okay? Okay. So look at my nose, okay? The reason is because I'm trying to see if you have a cut here. So look at my nose. Stare at my nose. How many fingers?
2.
Okay. All right. So I'm saying that this part of your body you're not seeing as much. I'm gonna check, okay? Take a look. How many fingers? Can you not see it? Okay. How many fingers?
2.
Okay. Fingers? Okay, you're looking at it. Okay, no worries. So it looks like he has a left-sided, kind of left bottom part of his vision. Might be affected as well. Again, that's something we'll have to see with time how it recovers. But again, that's something that occupational therapy will kind of might look at for vision issues, okay?
Okay.
So next step is, working with those therapies, making sure things are stable. Right now they're monitoring you, your blood pressure, making sure your nerve status is okay. Once you are stable at a medical standpoint, right, next step is acute inpatient rehab, where we talk about actually working with you more intensely, up to 3 hours a day, spread out throughout the day, okay? So it'll be physical therapy, occupational therapy, and speech therapy working with you. All right, sir? And so they'll work with you 3 hours a day, 5 days a week, sometimes 5 to 6 days a week. The rehab we have here is in Vallejo, California. And that's the inpatient rehab facility there. Did they talk to you a little bit about it yet, or has a social worker come and spoken to you about it?
Not yet.
Okay, so they will Monday. Usually the case manager, social worker will be working with you guys and talk about it. But until his medical status is stable, we can't send him there because they don't. If you keep going up and down, right, we don't have the ability to take care of that over there.
Right.
And so we want to make sure you've been stable for at least 1 or 2 days, mostly 2 days, okay?
Right.
And then we'll send you there to work on getting stronger and eventually getting back home. Now, could you tell me more about your home? Okay, I'm going to ask you how many steps to get into your home, sir?
1.
1 step, okay? And your bedroom and bathroom all on the first floor? Okay. Do you have any second floor aspect of your house? Okay, so for 1 step, that's perfect.
It's a single-story home.
Okay. Do you have a tub or a shower?
Both.
Both, okay.
It's a tub, that's a shower.
So you have to walk in, step into it.
Yes, step.
Okay, all right, okay. And then could you tell me about your profession? What were you doing before this?
Maintenance construction.
Okay, all right. And could you tell me what you're doing on a daily basis? Like what kind of activities you were doing on a daily basis with maintenance and construction?
I work on the GTA buses, but at the fuel facilities, repair gas pumps.
Okay. How much lifting were you doing by chance?
80 pounds.
80 pounds? Okay. And then kind of repairing things you said too? Okay, so the VTA. Okay, gotcha. And then you were working 5 days a week? 7 days a week. Okay, gotcha. So 7 days a week, maintenance, construction, VTA, fixing things, lifting up to 80 pounds at a time. And then it was like 8-hour day kind of thing?
Yeah, it all depends.
Oh, that's okay. Okay, got it. Okay, so that's important to know because I'm going to write in my note because when he goes to inpatient rehab, right, we just need to have that information so that, we can work with speech therapy and, occupational therapy or knows what we need to get you to, okay? After you do inpatient rehab, so that's usually, there's no guarantee of how long it is. Depends on how well you progress. Basically, their job is to help educate and actually get you more functional and as independent as possible to go home. And then you start outpatient therapies where you work, once every 2 weeks, once every week with therapies. Once you're more better, in terms of that. But you need to start walking, at least having some sort of way to move around before that. And given the fact that you're lifting up this leg for me, all of that, I think we need to work on this foot here, and we need to work on a lot of stuff, especially this foot. I think, you might be able to start, moving with some sort of device, okay? Now, whether or not you'll get back to your baseline, I cannot guarantee. But the good prognosis here is the fact that he's moving his hand. Again, that's one of the studies that have been done that show that that's a good sign, okay? Also, it sounds like, when I was reading through the chart, whenever I got the consult, I heard you're very motivated to get better, correct, or to work with him. So the main thing here is going to be you kind of doing homework in your bed, exercising as much as possible, your brain as well as your body, okay? Because the problem is with being in the ICU, being in the hospital, is sometimes you don't do anything throughout the day until the therapist comes in. If you're able to kind of just do an exercise workout where you lift up your legs, move around, try to sit up, all of that, preferably not in the bed, but sit up in a chair, that's all better because it gets your muscles moving, and otherwise you lose 1% of your muscle mass every day just being in bed. That's going to go against you.
So he's been wanting to get up to, like what you're saying, but they said they couldn't get the okay until
I saw him?
Until you saw him.
Okay, gotcha. Until me from rehab saw him? Okay, gotcha. Alright, so I will put that in my note, okay? Most likely, so that would be the person, so there's usually a hospitalist or intensivist that sees him. Just, if they're not cool with his, the blood pressure is pretty high, right? But getting him into the bed I don't think is going to be an issue as long as they keep monitoring it. So I think that's a good idea to get you moving. And I'd like you to start moving your legs, both sides, specifically if you're here, to work on his left side. Just talk to him on his left side. Stimulate him on the left side. That all is going to help in that aspect. And so that's what we're going to try to have. I'm going to write in my note as well, is that if people are able to talk to you and approach you from this side, sir, at least it's going to help with that neglect. See, exactly. You start looking this side. Otherwise, what happens is your brain reconnects and you start focusing too much on that side, okay? All right, so any questions at all for me? Okay, any questions at all?
No, thank you.
Of course, yeah.
So much.
Of course, okay. All right, you guys have a good day, okay? And then it's nice meeting you here, okay? All right, shake hands right here. Perfect. All right.